Hi everybody, I'm Dr. Brown. This is Dr. Bay and Dr. P with Physical Therapy San Pedro. We are three female doctors, and we're here to talk to you a little bit about pregnancy and being an athlete today. We were all pregnant. Actually, Dr. P is pregnant right now at some point, and we're all athletes. And we know that when you get pregnant and you're an athlete or you're exercising, there can be some questions, confusion about whether you should exercise, how much you should exercise. Is it safe for baby? Is it safe for me? And so today we just want to go over some of the do's, the don'ts, the myths, the misconceptions, and the great benefits of exercising through pregnancy. So exercise has really a lot of benefits, right? So Dr. Bay wrote most of this article for us, this blog, and I'm going to have her start with giving us some stats on why exercise is so great for us.
Yeah. When I was pregnant, I knew I wanted to continue moving because I always feel my best, but I had no idea there were so many benefits. We're going to go over a few of them now. Number one is big deal. There's less chance of a C-section when you continue to exercise throughout pregnancy at a moderate to somewhat hard rate. And Dr. Brown later is going to talk to you about how to judge that. Also,
I had a C-section.
Oh, did you?
Yes.
Wow.
And I exercised, but probably not the way Dr. Bay is telling us we should. Didn't have these stats.
Next, very exciting, is that exercising during pregnancy actually helps increase our cardiac output. What that means is our belly is going to develop a reserve of blood flow that's going to support our fetus during times of stress. And that means during labor, ladies. That's a big deal. Having that extra reserve seems like a great cushion of support.
Yeah, absolutely.
A safety net.
Yeah.
Lastly, prenatal exercise will decrease the risk of a large birth weight baby. As we know, the larger our baby gets, there's potential risks for mama and baby during delivery. So let's keep it as normal and as healthy as possible for everybody.
Yeah, didn't do that. Had a big baby, 9-12, that girl, which is why I had a C-section probably. A lot of reasoning, all these things. If I knew them, I would not have gone down the path that I went down.
So we're going to go over a little bit about the do's of exercise, right? Dr. Brown brought up a great point that there is more research, there's more stats now.
Yeah.
Okay, everyone comes from a different background, right? Dr. Brown had her baby 16 years ago. Dr. Bay has a toddler, almost toddler. But every year, every decade, there's new info coming out. So
it's an update.
Updates, yeah. So I come from more of a well, we all do, but I come from a pro exercise background, and I also work with women's pelvic health. And for the past few years, I'd say like 4 years now, I've been really helping the postpartum athlete. So after giving birth, allowing the athlete to safely return to sport has been like a huge passion of mine, and probably changed how I do physical therapy indefinitely. So I'm really happy to give you guys some do's to consider with exercise while pregnant. And I just, it's just something I'm really passionate about, and I haven't really had any contraindications in my pregnancy, thank goodness. It's just been really quite smooth, so I've been able to enjoy exercise and continue it throughout as good as I feel.
Yeah, absolutely. You want to give us any more of the do's?
Yeah, so we have a list on our blog, okay, so you guys can go read that. But my favorite one on there is listen to your body and do what feels good and do what brings you joy.
Yes,
right.
Absolutely.
So that's the most important thing. You shouldn't really try to start something new or compare yourself to others. Just have fun with what you've been doing and continue to do it and paying attention to your body. And really, it's all about movement and keeping your body healthy and strong to be prepared for what's to come and to prepare yourself for afterwards.
Yeah, for sure. And I think that you're
and to keep you sane.
Absolutely. And I think that's something that I admire in watching, and a lot of us have been watching you through your pregnancy journey. And, we all know Dr. P loves the barbell, right? And she loves kettlebells, and she's pretty much stayed on the barbell like most of her pregnancy. And really
Very
just,
exciting.
yeah, it's been awesome to watch, and just to show people that you can be safe, you can exercise, you can do what you love to do. She loves the barbell. She didn't want to give that up. And here she is, looking amazing and feeling great. So that's awesome. I think that as we train, one of the things that is really important is that you're watching your intensity of how you train. So you can do that a couple ways. One is RPE, looking at your rate of perceived exertion. We use that just in general with our patients on a day-to-day, every patient. And then another one that Dr. Bay talked about in this blog is the talk test. And you want to talk a little about what that is?
Yeah, just make sure that as you exercise, you're not out of breath. So that means you could carry on a casual conversation as you continue to move.
Right, absolutely.
Simple and effective.
And then simple things, monitoring your workload, not overtraining, listening to your body, and listening to what your body tells you should or shouldn't do. We have a lot of don'ts, right, Dr. Bay? You have an almost toddler too. You probably have experienced some don'ts.
Yeah.
So share with us, what are some don'ts on our list here, and any personal stuff?
Well, big one is don't move through pain.
Yep.
In my career, I've helped different pregnant women that have come in with varieties of pain, mostly in the low back and pelvic region. Dr. P was one of them. We were able to successfully help her pelvic position so she could not only feel better through the workday, but continue to move and enjoy life.
Yeah, absolutely.
PTs still need PTs.
Yeah,
That was a great
yes.
experience.
Yeah.
But luckily, she knew what to do at home. So
Yeah.
I didn't have to give her too many exercise prescriptions.
Good patient.
Yeah.
Yeah, but definitely do not hesitate to see if your PT can assess you and see what can be done to improve it. You don't have to just sit there and suffer in pain. Maybe there's taping methods, support braces, simple, safe exercises that can make the rest of your pregnancy journey comfortable and safe for everybody. Next is don't start something brand new. There's a lot of risk for injury when trying something new, to strain something, get into a position you're just not sure how to move through or get out of. And the worst would be probably a fall. We really want to avoid falling during pregnancy.
Yeah.
So I continued myself with trying to do ballet the best I could. Pilates came in really handy. There was adjustment pads so I could be at the right positions to not occlude the fetal blood flow. And then, I continued to walk my dog and lift weights lightly because that's what I did at the time. I wasn't a rock star like these two, but I'm getting
I didn't do barbell through my pregnancy. I didn't even know what a barbell was.
But I also encountered some of the signs to stop. So I actually had a higher risk pregnancy. It was found towards the end that my placenta was not feeding my daughter well. And I actually had to have her early because she didn't grow fast enough. So I had to back up and listen to my doctor's recommendations and actually diminish and eventually cease exercise or extra walking so that she could grow as much as possible for a healthy pregnancy. So it was really tough for me, but I did have to back off, and I did it, and I'm happy because I was able to give birth to a beautiful, healthy baby.
Yeah, that's awesome. Yeah.
And that's priority, right? That's where
Yeah.
you have to start changing the priorities and the mindset of exercise. So there's exercising for a purpose of yourself and strength, but then once there is some kind of risk to baby, then that's where you're gonna have to modify and really
all that really
decide
matters
what's
at
most
that
important.
point.
Yeah, the purpose, like you said earlier, like don't take up something new. Like you might have been watching Dr. P's journey and see that she's doing barbell work. That doesn't mean that because you're interested, it's a good time to start that while you're pregnant, right?
I've been doing
Yeah,
barbell work
yeah,
for like
she's
10 years now.
Comfortable with it.
That is my comfort.
Exactly, but the
And
goal
I'm
is to keep
definitely not a
moving.
runner, so
Yeah.
I didn't push myself to run because that wasn't comfortable for me. It wasn't joyful and it
Yeah.
didn't feel great.
Yeah,
So some women are out there still running miles in marathons.
yeah,
Yeah.
That's
it's
true.
just- there's differences.
yeah. The goal during pregnancy is really to keep moving, to feel strong, to feel better, to have a good, healthy pregnancy, to bring this baby into the world safely, but with you feeling still like you're yourself and you feel good, right? And exercise is always beneficial no matter what. I wish I would have exercised to the end when I was pregnant with my daughter. I stopped about like maybe like 5 or 6 months because my doctors at that time, 16 years ago, said, you need to stop. I got more encouragement around me to stop exercising because it was not safe, right? And we're just trying to bring education to the fact that that's not really true. That those are old myths, right? About exercise. Exercise can be safe, can be healthy. And actually, had I probably continued exercising, I wouldn't have had such a large weight gain towards the end of my pregnancy. I gained 57 pounds with her, which led me to have a big baby, which Dr. Bay talked about earlier. She was 9-12, and led me to have a C-section, which probably could have been prevented had I done some things a little differently. So we just want to help you guys who are maybe on that journey, who are questioning, whether it's safe or not, and encourage you to, to do what Dr. P did.
I also want to encourage everyone to educate themselves, because I know it's hard, especially with people that surround you. So
absolutely.
Different generations have different mindsets on things, and like I repeated before, that there's always new info. So even just me posting, things on my social media about exercise, I got various comments about, oh, is that safe? Or, oh, don't let the baby come early, or oh, no more than 5 pounds. And there's just so many myths of exercise, and not everything applies to everyone. And we've all had 3 different pregnancies and journeys. So just, you have to do what's right for you, consult with your doctor, and just, you don't have to listen to every single fear story that you hear. In life, just exercise is going to benefit you in some way. You just need to find the right way.
Yeah,
Yeah,
absolutely.
If you look down on the blog, there talks about signs and symptoms that you can assess to figure out if your body's reacting in a negative way.
Yeah, absolutely. Yeah. So you got to check out our blog, because in that it's going to go over all this we talked about, a little bit more detail, where Dr. Bay did an awesome job of putting in some red flags, some yellow flags, some contraindications, some signs, some warnings that maybe you should stop exercising, lots of cool stuff in there. So check it out. When Dr. P gets back from having baby Felix, we're going to go over the postpartum athlete, because we're going to see her journey continue into what that looks like exercising at home, because she has a whole gym at home of all this cool stuff, and we'll see if she puts it to use. Anything is possible.
I've got all the weights. So we had some heavier kettlebells, but now I'm like, okay, we got to stock up on 5s and 10s, because I'm going to have a whole process to go through, and I'll document it for you guys.
It'll be exciting. So so stay tuned for that. Check out our website, physicaltherapysanpedro.com. You can follow us on Instagram at Physical Therapy San Pedro, Facebook. We are going to be continuing to grow. We're in our space. We're doing lots of cool things. We brought in some new staff members, so stay tuned.
We have a
massage therapist. Yep.
Take advantage of her.
Yep. Some strength and conditioning classes that are starting this summer for athletes, for student athletes. So check that out. And did I forget anything, ladies?
All good stuff.
All good stuff. Thank you, guys. Bye-bye.